Are you taking semaglutide medications such as Ozempic, Wegovy, or Mounjaro? If so, you need to watch this video to make sure you avoid these potential detrimental side effects and maximize your results. Semaglutide medications have been taking over the weight loss space and have been used by celebrities such as Elon Musk, Amy Schumer, and Oprah Winfrey. Clinical studies have shown the effectiveness of these drugs, such as a 2022 study where patients lost approximately 6.9 kilograms at 3 months and 12.3 kilograms at 6 months. As amazing as these findings are, it is still important to be aware of the potential side effects so that patients can try to avoid them to the best of their ability. Some of the negative ramifications from taking semaglutide medications include loose skin, or what Dr. Paul Jared Frank, a cosmetic and celebrity dermatologist, coined as the term Ozempic face. Rapid weight loss can also result in a loss of muscle tissue, which can be detrimental to a person's metabolism and cause them to gain all the weight back plus more after getting off of the medication. Also, gastrointestinal side effects have been common, such as nausea, vomiting, diarrhea, and constipation. These symptoms are often mild and tend to improve over time. Can you do something about these potential problems? Yes. Let's look into some practical tips about what you can do. Do you want to avoid Ozempic face? What even is Ozempic face? Okay, so doctors have been describing Ozempic face as being changes in a person's face that may include more lines and wrinkles, loose and sagging skin due to a loss of fat cells, and a hollowed out appearance. The reason why Ozempic face is such a common occurrence is because semaglutide medications cause rapid weight loss, which is often more pronounced in the face. Facial fat serves a protective function and affects facial aesthetics and elasticity. Weight loss can make someone look older because the fat that stretches and cushions the skin is no longer in place. The skin of the face also loses its ability to retract after rapid weight loss due to reduced levels of elastin and collagen. So if you are taking semaglutide medications, maybe try some of these tips to prevent the facial side effects. Reduce the dosage. If you reduce the dosage, you may lose weight at a more gradual pace, which gives your skin more time to adjust and may prevent some of that sagging. Drinking 1 to 2 liters of water every day. Proper hydration is essential for skin health, so drink lots of water to help hydrate your skin and maintain your elasticity. Improving protein intake with a protein-rich diet. One of the proteins you should definitely be focusing on is collagen for your skin. Collagen is a protein that contributes to skin elasticity. However, it is a bit controversial and more research needs to come out, but it might be worthwhile just taking some collagen supplements to help mitigate some of that risk. Using filler. Some people who are finding that their skin is becoming more hollow may consider using small amounts of filler in their skin. However, huge caution, if you choose to get off this medication, there is a chance you will gain some of the weight back and it will most likely show up in your face. So be very careful with how much filler you use because you don't want to have an overfilled, puffy face. Also, something that I've heard different surgeons talk about, such as Dr. Ben Talley, he really recommends not putting fat in your face, which is a common procedure for people who want to fill out hollowness in their face. One of the things he warns people about is that if you put extra fat in your face and then you gain weight after this medication, you're gonna have a lot of fat in your face. So be very careful about doing any procedures soon after losing weight. Finally, give it time. Skin elasticity could improve over time, such as think of a pregnant woman who gives birth to a baby and then is left with all this loose skin. It takes time for that skin to go back to the muscle, and sometimes it doesn't fully go back, but a lot of the time it does. So be patient and allow your body some time to adjust. Rapid weight loss can be problematic because not only does the individual lose fat cells, but they also lose muscle tissue. This can have many repercussions, not only on your fitness and strength, but on your metabolism. Metabolism is the rate at which your body expends energy or burns calories. If we damage our metabolism, it can lead to difficulty losing weight, cravings, fatigue, and even dry skin. For example, a 2022 study showed that a year after participants stopped taking semaglutide medications, participants regained 2/3 of their prior weight loss. So how do you prevent your metabolism from being damaged? You prevent muscle loss. But how do you prevent muscle loss? Well, number one thing is prioritizing protein. Protein sources such as fish, meat, chicken, tofu, beans, dairy products can help control hunger, regulate blood sugar levels, and promote satiety. Protein is so satisfying that a lot of people who diet, if they pursue a high protein diet, they find that they're not hungry all the time, which actually mitigates a lot of the negative ramifications of dieting, which is hunger. However, there is still a debate if protein is enough to prevent muscle loss. Therefore, some people say that actually the only way to prevent muscle loss while losing weight is to combine exercise, particularly resistance training, with a diet that is higher in protein. This is because exercise stimulates muscle growth, but this process can only happen if you have adequate protein. So, prioritize protein and resistance training. Gastrointestinal side effects. Finally, how do we combat the gastrointestinal side effects, often associated with semaglutide medications? Take your medication with food. This may help reduce the likelihood or severity of gastrointestinal side effects, and it can also slow down the absorption of this medication. Gradual dosing. Start with a lower dose of medication, which may help your body adjust to it more over time. With all these things, remember, follow your healthcare's recommendations. I am not a doctor. Consult with your doctor. Stay hydrated. This can really help to alleviate the symptoms such as nausea and constipation. Dietary modifications, such as eating smaller meals throughout the day, can be helpful to alleviate some of these symptoms. Also, focus on eating a diet that's rich in prebiotic fiber, specifically, and probiotics. This just allows for good gut health, which may help, again, reduce some of these negative symptoms. To summarize some of the main points, prioritize protein in your diet, stay hydrated by drinking 1 to 2 liters of water every day, build muscle by practicing resistance training, and eat a diet that is rich in prebiotic fiber and probiotics. If you want to learn more about how to naturally lose weight without the use of medication, check out this video or this playlist to learn more. Wherever you are on your journey, remember to give yourself grace and be kind to yourself and to others.